Hello, ladies and gentlemen, a very warm welcome to eCancer's 5 Minutes With. Today we've got one of the great global research leaders. It's absolutely delighted to have Dr. Dorothy Lombe with us today at eCancer. Dorothy is a consultant clinical oncologist. She was recently, for quite a long time, at the Cancer Diseases Hospital in Lusaka, Zambia, and recently actually moved to New Zealand. Has an incredible depth of experience working in cancer control across Sub-Saharan Africa. I'm Richard Sullivan from King's College London, the Institute of Cancer Policy. And Dorothy, really very warm welcome to eCancer.
Thank you, Richard. Thanks for having me on this program.
Pleasure. And today we're actually going to be talking about an absolutely fantastic piece of work that Dorothy led. And it's here, it's on eCancer. I've got the wrong way around there. And here it is. It's a silk paper about silver linings. And Dorothy's going to talk a little bit more about this in a moment. It was published last year. Really exciting piece of work. Dorothy, before we talk about the paper and its findings, maybe let me just begin by asking you really the work you've been doing that led up to the particular paper that you published in eCancer, particularly with the COVID-19 and Global Cancer Task Force.
Yeah, thanks for that, Richard. So basically, the Global Cancer Task Force is a group of like-minded people who couldn't keep still during the pandemic. They saw something, an opportunity to actually do something, and we convened and started meeting regularly, and had a multi-pronged sort of group. And this was just one of the products of the work the task force actually do.
Wonderful. Now, just tell me a little bit. Obviously, your particular interest as well was what was happening in Zambia, but more importantly, a kind of reverse engineering of the good things that we learned about cancer care and research during the pandemic. Maybe tell the people listening and watching today, what were the key findings from your silver linings research?
Exactly. So what quickly came to our understanding about the pandemic, in cancer care at least, was that there was a lot of value placement happening. People couldn't move because of the non-pharmacological interventions of lockdown, and there was that restriction. And oncologists around the world, as well as policymakers, had to make the tough decisions of who moves and what gets done in such tight restrictions. And out emerged the theme of value. Now, what we have to obviously understand is that patient care, which is the center of what we do, is very important, but cancer care encompasses a lot of things, which includes training and research and so on. And the interest was actually to say, what have we learned and what has COVID accelerated or brought to the fore in terms of cancer care? So obviously, the first thing that came about was necessary treatments. Already we have a fantastic movement with colleagues, and that's called Choosing Wisely, where we want to make sure that the cancer treatments that add the most benefit and value to a system and to the patient are actually what is being utilized around the world. And as Richard, you introduced me coming from Sub-Saharan Africa, but also had the opportunity to actually work across 5 continents. I mean, my basic education in medicine was in Russia, spent time in Germany, spent a lot of time in South Africa, Canada, and now I'm in New Zealand. Basically, the patient wants to get cared for, but the resources across the board are very different, but the core purpose is similar. So basically, Silver Linings was saying, what have we learned? What has the pandemic forced us to realize? And, some of these things came about. So the first thing, if you allow me to quickly go into it, was the utility of less resources for more benefits. So radiotherapy fractionation, for example, we drag our feet about adopting new regimens and shorter treatments that actually don't cause toxicity. Breast cancer is a fantastic idea. Rectal cancer is also coming into the picture, but I'll tell you about breast cancer. For example, the UK-led fast forward trial, actually, it's taken us ages to move from the 25 fractions to 15 fractions. And now we've got 5 fractions that perfectly fine. We've got the evidence, and it really takes time for us to move this. The pandemic forced us. Same thing with prostate cancer. Pandemic forced us to move from 38 fractions to 20 fractions, and we know that there's a benefit there. So, when you talk about immunotherapy and having patients coming in all the time for treatment, that also curbed that aspect, because we knew this was a transmittable disease. We didn't want the interaction. We needed social distancing. So only the people who needed to be in the system actually came to the hospital. Experience from South America also brought the issue of decentralized cancer care. They've got a fantastic system there where is it really necessary for the patient to travel to the hospital? Is it possible for us to decentralize? And that came with the baggage of policy. So what's standing in between, if rolling out a very effective program with people who know what they're doing is basically the policy and the law. So with this, they had to be a waiver, allowed the cancer physicians to go ahead. So how are we going to go back to that post-pandemic? Those good things are actually going to continue because there will be good evidence that it was allowed and hopefully accelerate, the passing of such policies. Yeah.
It's a fantastic piece of work, and I would thoroughly recommend people reading it, because I think you really articulated something that was really important, which is to get the cancer community to face up to often low value procedures, care systems, and getting to think far more innovatively. But let me just maybe end by asking you this question really of, obviously the silver line is the positive aspect. There's, people will be aware of the many negative aspects in terms of delays and issues around that area. Where do you think, with all your experience and your ability to compare all the different continents you've been working on, where do you think we're going with cancer care in the post-pandemic world? And in particular, what do you think is going to happen to cancer care and services and systems in Sub-Saharan Africa? Recognizing, of course, that's a very diverse group of country.
Yeah. So that's actually a good question. The other terminology the group coined in association with silver linings were the shadows. With every cloud, with a silver lining, there's a shadow that's being cast down. So what was elicited was that, yes, there were positive things happening in distinct places around the world, but there's a lot of disparity. So, for example, mobile technology, which you and I are busy using very easily, could easily become a disparity for a postgraduate student who will now depend on internet and, a laptop somewhere deep, in Zambia, where it's just not taken for granted that everybody has access to this. So those shadows are particularly important to direct our future steps. And what I can say is that, unfortunately, it feels like even if we now have evidence to take us forward, we're not going to change too much, because you kind of fall back into the status quo once everything, gets back to relative normality. Yes. But we have good evidence for the disparities. If I can throw in, it's brought the conversation that has been the elephant in the room stark naked in front of everybody to say, we've been hiding this disparity, or we've been hiding this weakness with a lot of things, but this is there. Financial toxicity, disparities between Western countries and, low middle income countries and all that. So again, to summarize the future directions, I think we're armed with more information to actually help advocate for better, but this won't happen without hard work. We still need to do a lot of hard work, because people look out for themselves. That's just the natural status quo.
Yeah, no, thank you. And I think that's a fantastic point to end on, which is, we've seen some really big positive changes, but as you said, the pandemic's also illuminated maybe a rather harsh light onto deficits across all systems here. And I think, we all hope that, the political will be there to actually act on things going forward. Thank you very much indeed, Dr. Dorothy Lombe, for joining us today for 5 Minutes with E-Cancer. As again, it's a fantastic paper. Please go and read it. And there's lots of other works by Dorothy as well in E-Cancer and there are other links from the website. And again, once again, thank you so much for joining us from a very early, I think about 4 o'clock in the morning, New Zealand. So we're particularly grateful. Thank you very much, Dorothy.
It's always a pleasure, Richard. Thank you for having me.
Super.